This is Focus on Your Health on the KJAZ Radio Network. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and oh man, is it good to be back on the air with a new program. For the past several weeks, we've been replaying encore episodes of Focus on Your Health. I was away taking care of life, the universe, and everything. And I'm back, and I'm happy to be back. Man, I missed turning out new shows each week. Radio, like French bread, is best when served fresh. So anyway, I am back, and I have a number of fun and interesting shows on the docket, and I can't wait to bring them to you. About today's show. In mid-April, a group of young people got in touch with my wife, Dr. Lyanna LaFredo, and they said, we are KYCBUTT, that's an acronym, Kingman Youth Coalition, Beating Up Teen Tobacco. These kids are anti-tobacco activists, and they were getting ready to appear before the Kingman City Council. And, well, let's let them talk about their efforts. Here we go. All right, so who all is here? We have Tatum Newell from Kingman High School. She's a junior, senior type person, right?
Yeah.
Good morning, Tatum.
Morning.
You're a junior, senior type person because you're going to be graduating early.
Yes, a whole year early.
Good for you. And we have Victoria Davis. She's a junior at Kingman High School. Hi, Victoria.
Hi.
Welcome.
Thank you.
And we have Annie Meredith. Annie, what is your title?
I work with the KYCBUTT kids as the adult coordinator. We have a KYCBUTT club at each of the 3 high schools here in Kingman. So it's my job to pull them together and help facilitate, just getting them organized and helping them lead them in the right direction as a unit here in Kingman.
And you work for Mojave County.
I do. I work for the Mojave County Department of Public Health in the Tobacco Use and Chronic Disease Prevention Programs.
Welcome.
Thank you. Good morning.
Thank you. And we have Dr. Lyanna LaFredo. Hi, Dr. LaFredo.
Hello.
Welcome again.
Yeah.
You're on the show all the time. We have a lot to talk about, but Tatum and Victoria, my first question is, we're recording here on a Friday morning, and shouldn't you be in school?
Yes, we should, but sometimes during the day or like just randomly during the day, we actually get pulled out so that we can do these events.
Really?
Yeah, so they're school excused and everything, and we go back to our teachers if we have anything that we missed.
Okay.
It's for a good cause.
I know somebody who could write you a doctor's excuse. I'm just curious.
They do get pre-excused absences from their teacher sponsor.
Okay.
Yeah. It's all scheduled in advance.
Well, I mean, for the record, I'm a big proponent of the occasional day of truancy. I just want to go on the record. I'm old now. They can't catch me. I'm. If you've heard of a statute of limitations, it's all past for me. So, you ladies are with KYCBUTT, Kingman KYCBUTT, which is KYCBUTT. What does that stand for?
Kingman Youth Coalition Beating Up Teen Tobacco.
Okay. Beating up teen tobacco. So what are we talking about? What is the mission of this group?
To educate our community on the effects of tobacco and to help other people have a better understanding of what it can do to you and do to the people around you.
Annie, how long has this group been in existence?
KYCBUTT started in Kingman in 1997.
Wow. So
that's 18 years.
These 2 girls weren't born then.
They weren't. And I actually was just graduating from high school that year myself. But I have had the privilege of working here with them in Kingman for the last 7 years.
Okay. Wow. And a lot has happened with the group. You've been part of orchestrating changes in city ordinances. Is that right?
Correct. Yes. These girls are definitely change agents. They are what we like to see from the young people in our community, and they tackle policy head on. They get to, at the beginning of each school year, pick what they want their big project to be. What kind of policy do they want to work on? What kind of areas do they want to help improve the health of their community? It doesn't necessarily have to be a policy. But ever since I've had Victoria and Tatum specifically for the last 3 years, they've been very passionate about secondhand smoke. Mm-hmm. So they started with a park zone policy, no smoking in around the playgrounds and the areas where people congregate. And then this year they said, we want to make it illegal to smoke in cars with kids because, they really want to just speak up for those that can't speak up for themselves.
Right. Victoria, before that city ordinance went into effect, I guess one was allowed to smoke in a public park, right?
Yes.
You could hang out by the sandbox where the little kids are playing, and you could have a big fat cigar if you wanted, right?
Yeah, they didn't have any signs up or anything saying where you could and couldn't smoke. And that was especially an issue when there were children playing around and they were trying to play and they were breathing in cigarette smoke, which we know isn't healthy in any means.
What was the process of, so you saw this problem and you said, okay, here's what we're going to do to try to fix this. What was the process of taking it from that idea to actually having a law passed?
We did a lot of park cleanups. So we would go to the park on the weekends and we would pick up cigarette butts and that were left out. And we collected those to show our city council that this is a litter and this is how much people are smoking in our parks. And after that, we talked a lot with the Clean Commissions Committee with Mike Mearsman.
Okay.
And he's the director of the parks. And we scheduled out areas where we would like to see smoke-free zones. And then areas where smokers could smoke freely.
It's an administrative policy, so it's not an ordinance.
Okay.
But it's through the Parks and Recs, which is a part of the city. It is they've made it a policy, and we really had to give a hand to the Parks and Recs Commission because they really stepped up. As soon as they saw these guys walked in there with 20 gallons of cigarette butts and just set them down at the council meeting. And nobody had any idea. Number one, we hadn't previously provided any type of tobacco litter receptacles in our parks. So we weren't even giving them the option to dispose of it properly in the first place. So they immediately, even before any action was taken, the Parks Department stepped up, created their own, fabricated their own containers and installed them in all of the parks.
Okay.
Yeah, it was pretty awesome.
Tatum, when you were working on this project, did you get any negative reaction? Did you have anybody say just kind of mind your own business?
I joined the club after they were in the process of doing this, but from what I've heard, it was kind of a fight. I mean, they did have people oppose it, and after signs got put up, a lot of people decided to vandalize it.
Oh, really?
And tear them down or just knock them over or write on them.
Victoria, were you around for the fight about it?
Yes, I went to the council meetings when they were still debating whether or not they should start a policy on it.
How did it go? Was it nasty?
It wasn't nasty. They were more concerned over smokers' rights and how it would affect that. So that's another reason why we actually included smoke zones so that the smokers could smoke.
Okay.
Because we didn't want to completely take away all of their rights to smoke in public or anything. So I think in council, when we were talking to them, that was one of the biggest fights that we had. How are we going to mediate between smokers and non-smoker rights?
Right.
They had a big concern about enforcement when it first started, and I think that's what the majority of the heated discussion, and there was never any arguments or anything, never got hostile or anything, but they were concerned that, we have heavily utilized parks and things like softball are year-round sports. It brings in a lot of people from the outside. How would that affect that? At some of, the bigger sporting events, there is alcohol allowed. So if people were drinking and then somebody asked them not to smoke, could it potentially turn into something? But it's been very self-enforcing, which is what it was intended to be.
Right.
And with anything these guys work on, they're never against smokers. And they have a really hard time, making sure people understand that because they're about helping prevent younger people from becoming smokers and from them being exposed to secondhand smoke. It's more about getting big tobacco to leave kids alone than it is, taking away smokers' rights.
About menacing the smokers.
Exactly.
Yeah.
But I would say overall, the smoke-free zones is working very well.
Now, I didn't mean to ignore you,
No,
Dr. LaFredo.
these are
I'm
all
sorry.
interesting.
Yeah, this is a fun group.
Yeah. And actually, I like, listening to them, because it just shows the passion you have for this cause. And it made me curious to know why, and, how you became passionate, like how you became involved in this cause.
I guess I could say I was like most kids. I had never even thought about smoking in general or any tobacco use products until I joined the club. And I kind of just signed up because I was like, oh, this club looks interesting. And they invited me to the city council meetings when they were going to talk to the council. And I was really intrigued, and I didn't realize that someone my age could make such a difference on the community and could like bring forth a policy. And so I was kind of like surprised and intrigued by it, and I kept going, and they kept teaching me all these things about it, and I would talk to like younger kids and I would explain to them, and I think that's kind of how my passion started. It wasn't from the start. It like grew on the more I was in the club.
Okay.
How about you, Tatum?
My passion for this club started with my first meeting. I went there with a friend, and after I found out what the club was all about, it put a impression on me, because I have personal experience with a smoker that got cancer, and he got a laryngectomy, my grandpa, and it was just really hard to deal with. And then I thought, well, maybe if I stay in this club, it seems like they make a difference throughout the community, and that's what I started like wanting to do, was impose a better impression on the community.
Dr. LaFredo, can you describe the laryngectomy?
Is it a cancer of the larynx? Is that what he had? And so they have to remove it. And because it's the cancerous part, so it doesn't spread to the rest of your body. But then, because the larynx is the voice box, so you can't talk.
Yeah.
And then you'll have to, well, for a lot of people, they'd have I guess the electronic. They'll have that electronic microphone or something, so they'd be able to speak.
What they did with his procedure, they took out his whole esophagus and stretched his stomach tube up to make it into an esophagus, and they pulled his stomach up, and so now his stomach is where his chest is, so right below his lungs. Yeah.
So he's still around.
Oh, yes.
I know you ladies go in and you talk to different school groups, community groups. Do you talk about this part of it?
Not particularly. We, if we get questions from the kids that ask about, oh, what about the hole in your throat? Is that true? Can you get that? Annie usually leaves that up to me to answer, but normally it's not something we reach on because we don't want to scare the kids that much.
It is very graphic.
Is gruesome, isn't it?
Yeah.
Boy. Time for a quick break on Focus on Your Health. Dr. LaFredo and I will return in just a moment for more with Tatum Newell, Victoria Davis, and Annie Meredith of KYCBUTT, Kingman Youth Coalition Beating Up Teen Tobacco. This is the KJazz Radio Network.
Hey, you smoke too much of what it was to be in a pocket all padded up.
And welcome back to Focus on Your Health here on the KJazz Radio Network. This week my guests are Tatum Newell, Victoria Davis, and Annie Meredith of KYCBUTT, Kingman Youth Coalition Beating Up Teen Tobacco. They're visiting with Dr. Lyanna LaFredo and me, the guy with the microphones. Now you little troublemakers you're working on a new, what would the term be? It's not necessarily an ordinance. It is.
This would be a city ordinance.
This would be a city ordinance.
This would be an official in the book city ordinance.
And what's this one about?
This would be an ordinance to prohibit smoking in the car when a minor is present.
Okay.
That would include both traditional cigarettes and electronic smoking devices. It's important that they're both included because they both have health effects on those that are around them. This would be a secondary offense. So like Tatum had mentioned, you wouldn't be pulled over for it. But if you were speeding or had an illegal lane change or similar random traffic violations,
Right.
and you were smoking in the car with a minor, it could be an additional citation at that time. So that's what they're proposing. The other important part is they don't just want people to be fined. They don't want people to be out that income that could be going towards their family or feeding their children.
Okay.
So they have written into their proposal that, there would be a fine, or if the court approved, they could take a tobacco cessation program and learn about, what smoking is doing to them, what their smoking is doing to others. That way they can include that education component. And then the community would just be better for it.
Okay. Yeah. So now you're going to be going in front of the city council here in a couple of days did they know anything about this, or is this the first time you're bringing it up with them?
No, we actually met with all but one of the council members and went over our policy or ordinance so that it wouldn't just be thrown at them, and so that they had an understanding of what we were doing and why we were doing it before we were addressing it to them.
Okay. So you went through it with all but one. So I am the one, let's just say, who wasn't there. Tatum, convince me this is important and worthwhile.
Secondhand smoke, it affects children just as much as anyone that would be around it. But children at the most, because when they're in a car, children don't feel like they have the say to talk to an adult and say, please stop smoking when I'm here, or can you stop? It's not, even as a teenager, I don't feel like I have that right. And so what we're trying to do is give a voice to those that can't speak for themselves.
Dr. LaFredo, talk a little bit about secondhand smoke, would you please?
Okay. Well, secondhand smoke is, the smoke that's generated from cigarettes or e-cigarettes. That's not like that. It's secondhand because it's smoke that you breathe in, even though you're not smoking. So it's for, people around a smoker, and they get exposed to the smoke from cigarettes. And the smoke contains a lot of harmful, chemicals that, and it's classified as a carcinogen. It causes cancer, known cause of cancer. It also has like formaldehyde, cyanide, hydrogen cyanides, all of these nasty chemicals. And imagine, especially for younger kids whose lungs are still developing, it affects how their lungs develop. So they end up having weaker lungs. It can cause asthma. It can contribute to pneumonias, frequent ear infections, and all of these other medical effects, like health effects.
I have heard talk that secondhand smoke can be more injurious than firsthand. Is that sort of like an urban legend, or is there any truth to that?
Well, I don't know if it's as dangerous or if it's equally dangerous. Yeah.
When we talk to the elementary school kids and when we try to explain how harmful secondhand smoke is, we like to tell everyone that whatever a smoker can get, somebody else can get from secondhand smoke. Okay. So there are people who are diagnosed with lung cancer that the doctors is from smoking, and they say, well, I've never smoked a cigarette in my life.
Yeah.
But they have somebody who they know and who they are close with who does smoke. So that's how they get it.
Because they're breathing in all those chemicals that a smoker would.
Right. Mm-hmm. Annie, when you talked about this ordinance that you're working on, you were careful to mention it includes e-cigarettes. Can you say a little bit about those? Yeah,
so that's definitely a tough, subject, because unfortunately there's not a lot of research.
Yeah.
But there is some research, and we are able to pull, as soon as they come out with something, we're able to include that to educate the community. But what they are finding in that secondhand vapor, there is nicotine in that, which we all know is the addictive drug in the cigarette. There are also finding metals, which if inhaled could really irritate your lungs. And then also formaldehyde which is one of those carcinogens that's in a traditional cigarette also.
Yeah.
So even though we don't have any long-term scientific research, and of course we all know the FDA has not yet made their ruling, we want to include it because we know that if they're breathing in that vapor also, that they are getting nicotine and they are getting those metals and at least a couple of the carcinogens that have been found thus far.
Yeah.
And I think that's important to educate people about that, like about the effects of e-cigarettes. Just today, I was reading among teenagers and adolescents, the rate of cigarette smoking has gone down, but the rate of kids using e-cigarettes have tripled. So.
The ones the kids primarily use, we call them or refer to them as hookah pens.
Okay.
They're bright, they're shiny, they're colorful packages. They have fun flavors like blueberry blast or peach mango paradise. They are definitely targeted towards young people.
Yeah.
And you see that, this year, these guys have probably presented to about 3,500 kids in the city of Kingman through the Unified School District, and the academy schools also. And we really did a lot of middle schools this year because that's where these products are hitting the kids.
Yeah.
We see 6th, 7th, 8th graders that are, some are smoking regular cigarettes, but a lot of them are using these electronic products, and they really have no idea how it could harm them. We really open their eyes, and these guys do an amazing job at reaching those kids.
They're the best messengers, really, because kids will listen to other kids, but they.
Well, it was cool because you walked in, and we've turned the doctor's office into this little studio today. We have a bunch of microphones everywhere, and you just sat down. And you're like, okay, let's go. And I don't know if you realize that's a special thing, but like I put microphones in front of people in their 30s, 40s, and 50s, and they're like, and you're like, yeah. So there's this experience of having talked to people and being, it's very cool. And here's what I wonder. In your lives ahead, when you go off to college and you go off into your professional lives, how does this stuff, how do you think these experiences will influence you? Are you interested in politics? Are you interested in policy?
I think that KYCBUTT, it doesn't always, in the future, really what it helps us with is public speaking. So we're going to have a lot of skill and experience with public speaking. If you want to go into policy, Victoria, and become president, whatnot. I think KYCBUTT has just really prepared us we've matured a lot.
Yeah.
I think I've gotten a lot of maturity and skills that I can bring to the workplace, and maybe not being a politician, but somewhere in my future career.
Victoria, would you like to declare your candidacy?
I don't know if it's helped me become ready for presidency, but I've definitely learned that I should always view the other opponent's side. So I don't necessarily defend my side down to like the grave. I take a minute and I look at how the smokers are viewing all these changes on them. Yeah. And I try to mediate something so that we are both equally or somewhat happy with the decision that we've made. And like Tatum said, public speaking, definitely. I've learned a lot, and I used to be, I guess you could say, like that fear of going up in front of like a group of people and speaking, and that fear's not naturally gone because of this, but it has helped me gain confidence in it. And I've also met like a lot of important people through it. Like I've met our council members. I've met Senator Kelly Ward. Yeah. I've met Sonny Borelli.
You've met us.
I've met both of you guys. And I probably wouldn't even have met these people if it wasn't for KYCBUTT. So for that, I am thankful.
My thanks to KYCBUTT, Kingman Youth Coalition Beating Up Teen Tobacco. You heard Tatum Newell, Victoria Davis, and from the Mojave County Department of Public Health, Annie Meredith. They've promised to keep us updated on their efforts.
That's it. I quit.
We recorded our chat in Dr. Lyanna LaFredo's office at Joshua Tree Pediatrics, Kingman Regional Medical Center. I'm TG LaFredo. Thanks so much for listening, and please join me again next Saturday at 11:30 a.m. for another edition of Focus on Your Health, right here on the KJazz Radio Network.